Hi, I am the new classes of antibiotics, and I have 4 classes. For my first class, Daptomycin, my brand names are Quinupristin and Quinupristin RF, and my chemical name is a bit complicated. For my drug classification, in terms of therapeutic, I am an antibiotic. In terms of pharmacologic, I am a cyclic lipopeptide antibacterial agent. For my pregnancy category, I am a pregnancy category B. For my mechanism of action, I binds to bacterial membrane and causes rapid depolarization of membrane potential. I also inhibit protein, DNA, and RNA synthesis. For my pharmacokinetic, in terms of my route, I am administered IV. My onset is rapid, my peak is unknown, my duration is unknown, my half-life is 7 to 8 hours, I am metabolized in the liver, I am excreted in the kidney as a urine, and in the intestine in a form of feces. For my indications, I am indicated to complicated skin and skin structure infection caused by aerobic gram-positive bacteria. For my contraindication, I am contraindicated in patients with a known hypersensitive reaction in me and any component within my formulation. For my side and adverse effects, in the CV includes headache and insomnia. In the GI includes diarrhea, increased liver function test, nausea, taste alteration, and vomiting. And for local includes injection site reactions, edema or inflammation, or pain at injection site. Nursing responsibilities for the assessment first is monitor for and report muscle pain or weakness, especially with concurrent therapy with HMG-CoA reductase inhibitors or statin drugs, SNDs or signs and symptoms of peripheral neuropathy, superinfection such as Candida disease. Second is lab test. Perform CNS before treatment is begun, baseline renal function test, weekly CPK levels, PT over INR during the first few days of Daptomycin therapy with concurrent warfarin use, daily blood glucose monitoring in diabetics, serum electrolytes for signs and symptoms of hypokalemia or hypomagnesemia, and withhold drug and notify physician if there are signs and symptoms of myopathy developed with CPK elevation of greater than 1,000 units per liter. For patient and family education, report any of the following to the physician: muscle pain, weakness or unusual tiredness, numbness or tingling, difficulty of breathing or shortness of breath, severe diarrhea or vomiting, skin rash or itching. Do not breastfeed without consulting the physician. For my evaluation, there should be resolution of signs and symptoms of infection. The length of time for complete resolution depends on organism and site of infection. Come now to my second class, Linezolid. My brand name is Xerox, and as usual, my chemical name is complicated. In terms of my drug classification, for therapeutic, I am an antibiotic. For pharmacologic, I am an oxazolidinone, and for pregnancy category, I am a pregnancy category C. My mechanism of action is inhibition of protein synthesis via 23 rRNA of the 50S subunit. For my pharmacokinetics, my route is PO, and the onset is rapid, the peak is 1 to 2 hours, and the duration is unknown. For my route as an IV, the onset is unknown, the peak is unknown, and the duration is unknown. My half-life is 3 hours, I am metabolized in the liver, and I am excreted in the kidney as a urine and in the intestine in a form of. For my indications, I am indicated for gram-positive infections and approved for treatment of bacterial pneumonia, skin and skin structure infections, and vancomycin-resistant enterococcal or VRE infections, including infections complicated by bacteremia. I am contraindicated in patients hypersensitive in me and my components, used cautiously in patients with uncontrolled hypertension, pheochromocytopenia, carcinoid syndrome, or untreated hyperthyroidism because Linezolid or I wasn't studied in this patient. For my side and adverse effects in the CV include headache, insomnia, and thrombophlebitis. In the GI includes diarrhea, increased liver function tests, nausea, and vomiting. In the hemat includes thrombocytopenia and anemia. In the derm includes pruritus and rash. In local includes injection site reaction. For the assessment, monitor for signs and symptoms of bleeding, hypertension, or pseudomembranous colitis that begins with diarrhea. Lab test CNS before initiating therapy and during therapy as indicated. Drug may be started pending results. Monitor complete blood count including platelet count and HGP and HCT in those at risk for. For the assessment, monitor for signs and symptoms of bleeding, hypertension, or pseudomembranous colitis that begins with diarrhea. Lab test CNS before initiating therapy and during therapy as indicated. Drug may be started pending results. Monitor complete blood count including platelet count and HGP and HCT in those at risk for bleeding or with less than 2 weeks of the. For patient and family education, report any of the following to physician promptly: onset of diarrhea, easy bruising or bleeding of any type, or signs and symptoms of superinfection. Avoid foods and beverages high in tyramine such as aged, fermented, pickled, or smoked foods and beverages. Limit tyramine intake to less than 100 mg per meal. See information for patients provided by the manufacturer. Do not take OTC cold remedies or decongestants without consulting physician. Note for phenylketonurics, each 5 ml oral suspension contains 20 mg phenylalanine. For my evaluation, the nurse should evaluate for the resolution of signs and symptoms of infection. Length of time for complete resolution depends on organism and site of infection. My third class is Quinupristin or Daptomycin. My brand name is Seed and my chemical name is a bit complicated. For my drug classifications, for therapeutic, I am an antibiotic. For pharmacologic, I am an streptogramine derivatives. For the pregnancy category, I am a pregnancy category B. For my mechanism of action, there is an inhibition of mRNA translation by binding to the 50S subunit of bacterial ribosomes. For my pharmacokinetics, for my route, I am administered IV, my onset is unknown, my peak is unknown, and my duration is unknown. For my half-life is 7 to 8 hours, I am metabolized in the liver, I am excreted in the kidney in the form of urine, and in the intestine in the form of feces. For my indications, I am indicated as a treatment of serious or life-threatening infections associated with vancomycin-resistant Enterococcus faecium or VREF, complicated skin and skin structure infections caused by Staphylococcus aureus or Staphylococcus pyogenes. For my contraindications, I am contraindicated in patients hypersensitive in me or other streptogramine antibiotics. For my side and adverse effects, in the CNS includes dizziness and somnolence. In the derm includes pruritus and rash. For local includes injection site reactions, edema, inflammation, or pain at infusion site. In the MIS includes allergic reactions, including anaphylaxis and pain. For the nursing responsibilities, for the assessment, monitor for signs and symptoms of infusion site irritation. Change infusion site if irritation is apparent. Monitor for cutaneous reaction. Examples are pruritus or erythema of neck, face, or upper arm. Lab test CNS from site of infection prior to initiating therapy. WBC with deferential and liver function, especially with a pre-existing hepatic insufficiency. For patient and family education, report burning, itching, or pain at infusion site to physician. Also report any sensation of swelling of face and tongue, difficulty of swallowing. Do not breastfeed while taking this drug. For the evaluation, the nurse should monitor or evaluate resolution of signs and symptoms of infection. Length of time for complete resolution depends on organism and site of infection. Let's come now to my fourth and last class, Tigecycline. My brand name is Tigecycline and my chemical name is too lengthy and complicated. For my drug classifications, for therapeutic, I am an antibiotic. For pharmacologic, I am an glycylcycline. And my pregnancy category is pregnancy category D. My mechanism of action is there is inhibition of protein synthesis by a 30S subunit. For my pharmacokinetics, in terms of my route, I am administered IV. My onset is unknown, my peak is unknown, and my duration is unknown. My half-life is 42 hours. I am metabolized in the liver, and I am excreted in the kidney in a form of urine and in the intestine as feces. For my indications, I am indicated in patients 80 years of age and older for the treatment of complicated skin and skin structure infections caused by susceptible isolates of Escherichia coli, Enterococcus faecalis or vancomycin susceptible isolates, Staphylococcus aureus or methicillin susceptible and resistant isolates, Enterobacter cloacae, Klebsiella pneumoniae, and Bacteroides fragilis. I am contraindicated with diarrhea manifestation with Clostridium difficile bacteria, high amount of bilirubin in the blood, abnormal liver function test, pregnancy, a rupture in the wall of the stomach or intestine, pancreatitis, child book class B, liver impairment. For my side, and adverse effects in the neuro includes optic neuropathy and peripheral neuropathy. In the GI includes diarrhea, increased liver function test, nausea, taste alteration, and vomiting. In the intake includes increased sweating. In the GU is renal failure, and in the derm includes pruritus and rash. Let's come now to the nursing responsibilities. In the assessment, monitor for hypersensitivity reaction in those with reported tetracycline allergy. Monitor for and report signs and symptoms of superinfection or pseudomembranous enterocolitis. Lab test C&S prior to initiation of therapy, periodic serum electrolytes, LFTs and kidney function tests, PT and INT with concurrent anticoagulant therapy, and monitor diabetes for loss of glycemic control. For patient and family education, avoid direct exposure to sunlight during and for several days after therapy is terminated to reduce risk of photosensitivity reaction. Report to physician lost stools or diarrhea either during or shortly after termination of therapy. Use a barrier contraceptive in addition to oral contraceptives if trying to avoid pregnancy. Do not breastfeed while taking this drug without consulting physician. For the evaluation, the nurse should evaluate resolutions of signs and symptoms of infection. Length of time for complete resolution depends on organism and site of infection. Thank you for watching. I hope you learned a lot. Bye.